Good evening, everyone, and welcome to our program tonight. I'm Dr. Cindy Russell, co-chair of the Santa Clara County Medical Association Environmental Health Committee. Thank you for joining us for our second environmental health webinar series. This is part 2 of our series, and we're going to be discussing tonight artificial turf, promise or peril. Artificial turf was introduced into the sports world in 1965, and currently there are approximately 13,000 synthetic turf sport fields in the United States, and the number is increasing. While in the past, artificial turf seemed to be the best alternative for sport fields and lawns due to reduced costs, reduced water usage, and lower maintenance, newer information has come to light regarding the direct and indirect environmental and health impacts of synthetic turf. It's now recognized as a global problem. Concerns include toxic chemical and plastic pollution with risk to children and the environment, creation of urban heat island effects with heat illness in athletes, sports injuries, and disposal challenges. That's in addition to climate change impacts and water usage on artificial turf. While there's controversy over removing artificial turf fields, we're going to be focused tonight on the health and environmental effects. Some cities are banning artificial turf, and the Netherlands is the first country to ban all artificial turf on sports fields by 2030, with the Dutch Professional Football League banning plastic pitches from the 2025-26 season. Our experts tonight will review the health risks of artificial turf, as well as the different components used, ways to stay safe on artificial turf, as well as alternatives to artificial turf, that is to say, natural grass fields. Just want to remind you that our third and final session of this year will be 2 weeks from now at the same time, 6:30 p.m. on Tuesday, October 15th. And we're going to be discussing environmental toxins, environmental illness, root causes, and prevention with speakers Christopher Diadamo. He's going to talk about total load, the synergistic effects of modifiable lifestyle factors and environmental exposures on human health. Pete Myers is going to talk about the impact of plastic additives on the health of future generations. And Dr. Ray Dorsey is going to talk about the root causes of Parkinson's disease. So join us for that webinar as well, and bring your notebook. We're going to be learning a lot about health, plastics, toxins, and prevention. So I want to let you know tonight for the webinar, you're muted. We're going to take questions from the Q&A box after the webinar, but you can submit questions anytime you wish. And the chat box will be disabled other than for us to provide links and resources for you. These presentations are recorded, and they're going to be available on our website at sccma.org after the webinar. So now I'm honored to introduce our first speaker, Dr. Sarah Evans. She's going to be presenting artificial turf and children's health. Dr. Evans is assistant professor in the Department of Environmental Medicine and Climate Science and a member of the Institute for Climate Change, Environmental Health, and Exposomics at the Icahn School of Medicine at Mount Sinai. She's an active faculty member in the Mount Sinai Children's Environmental Health Center, the Center on Health of the Environment Across the Lifespan, Community Engagement Corps, and the Mount Sinai Institute for Translational Sciences. Dr. Evans' research is focused on the impacts of early life environmental exposures on the nervous system development and child behavior. She's dedicated to translating complex science on the health effects of toxic chemicals in order to help others advocate for healthier policies in their local communities to reduce toxic exposures. Dr. Evans obtained her doctorate in neuroscience from Weill Cornell Medical College and her master's in public health from Mount Sinai, where she also completed a 3-year fellowship in environmental pediatrics. Thank you so much for being here, Dr. Evans.
Thank you so much for that introduction and for having me. I'm going to go ahead and share my screen. And I will put this in presentation mode. Might take a second. Does that look okay? Is that good? Okay, great. Okay, so I just wanted to first introduce where I'm coming from, and I am a part of the Institute for Climate Change, Environmental Health, and Exposomics at Mount Sinai, where I work with a team of researchers and pediatricians who are interested in uncovering the early life causes of disease. And so I also work with our pediatric environmental health specialty unit there. We are the Region 2 PACU, and we're part of a national network of pediatric clinics that are specially trained in environmental health. We also have a statewide network, the New York State Children's Environmental Health Centers, that similarly seeks to increase the capacity of clinicians to recognize, diagnose, and treat diseases of environmental origin. And we receive funding from not only New York State and the EPA, but the National Institutes of Health. And so collectively at Mount Sinai, we are really dedicated to bringing research to action, both in the clinic and in the community and to decision makers. So we conduct cutting edge research, we provide healthcare, and we educate communities and advocate for change. And the work that we do at Mount Sinai is really driven by the fact that chronic diseases are on the rise. I think there are many clinicians on the call tonight who recognize that our lifetime risk of many chronic illnesses has doubled or tripled in the last 20 years. And these diseases are increasing at rates that cannot be explained by genetics alone or by changes in diagnostics. And so this really indicates that there are environmental factors that are predisposing us to increased risk of disease later in life. And so again, I just wanted to highlight some of the resources that we have at Mount Sinai before I start talking about turf, because these may be resources that you are interested in accessing. And this is our PACU and also our environmental pediatrics clinic. And our New York State network. And if you click on the QR code, or I can provide you with information later, you can learn a little bit more about how we're doing this in New York State. We have a network of 7 academic medical centers who are really, again, building capacity in understanding environmental origins of disease. So with that context, I kind of wanted to introduce to you why we think about artificial turf so much and how this came about. And these are a couple examples of the many, many cases that have come to us through our center and through our PACU from concerned residents and communities about artificial turf. So, in this sort of common example, the community wanted to install 4 acres of artificial turf, plastic grass for children's soccer, and people live around this field, and no one was notified that this large plastic surface was being put down, and they want to know, what can we do? Is this going to cause harm to our children or our environment? In another somewhat extreme case, we were contacted because a developer wanted to put a artificial turf field on top of a 200-car parking garage above an area of wetlands. And so we were contacted to advise on whether that was a good idea, and why we wouldn't recommend against that. So we get many inquiries like that. And this really dates back to probably around 2007, which is before I joined Mount Sinai, when there were lawsuits because individuals found high levels of lead, which is a neurotoxicant, in artificial turf fields. And then several years later, Amy Griffin, who is a soccer goalie coach in Washington State, started to notice that some of the players that she coached were getting cancer at what she thought might be, higher rates than the general public. And I just put this here, not to necessarily comment about this study right now. We can talk about that later. But just to say that there was a lot of media attention and concern around these products, that led to a lot of inquiries and ongoing concern. And I will say that despite some of this, there are still an estimated 16,000 artificial turf fields all over the country, and something like 1,500 that continue to be installed each year. So these continue to be very common, even though we hear more and more, again, in the media about concerns related to exposures on artificial turf. Another high-profile story is investigating whether play on artificial turf is linked to cancers in Phillies baseball players. So you've probably seen a lot of this. And so quickly, what is artificial turf? So it's a multi-layer surface that's used not only on athletic fields. We think about it, and most of the consults that we get are related to athletic fields, but turf is also used on playground surfaces, in residential yards, and so on. But generally, when we think about it, we're thinking about an athletic surface like this, which has plastic grass blades and some sort of infill that helps to keep the blades in place, and then various levels of padding beneath for cushioning and also for drainage. The most common type of infill that's in between these grass blades is made from recycled tire crumb rubber. And this is actually the crumb rubber that was in one of my daughter's soccer cleats after she played for a few hours on a turf field this summer. So that was from one shoe that we were able to dump out. It's also in her socks and in my car and essentially all over everything that came home with her. And so if anyone has played on those surfaces, they understand how that happens. And this is just an example of another type of artificial turf surface that we get a lot of inquiries about, and that's a poured in place playground surface. So often these playgrounds have a base layer that's made of that recycled tire rubber as well. And then on top, they may have what they call a virgin rubber or some type of plastic that includes urethane and sealants to help it stick together, and probably a coating and a colorant. I'll talk a little bit about some of the chemicals of concern in artificial turf in general. But since I'm largely talking about athletic fields, but just know that many of these chemicals are also found on the playground surfaces. And you can see here where a playground surface is actually degrading. And so that virgin rubber or plastic top surface is exposing the recycled tire rubber beneath. So again, I'm going to just quickly talk about children's vulnerability, some about chemical exposures, and about heat, and about injuries and abrasions. And so these are the health risks that we, within our pediatric environmental health specialists at Mount Sinai, are most concerned about. And so we have a saying that children are not little adults, and so their behaviors and their physiologies are very different from adults, and that makes them more susceptible in general to environmental exposures and also to exposures that might occur when they play on artificial turf. So of course, they're closer to the ground, they roll around, in the dirt, they put their hands and other objects in their mouths, so that increases their risk of ingestional exposures as well as skin exposures. And when we think about heat exposure on turf, which I'll talk a bit about, they're less able to regulate their body temperature well. They're less likely to get a drink of water when they become dehydrated or very thirsty. And then they also breathe more rapidly and take in a greater volume of air than adults do. And so they're more vulnerable to any types of inhalational exposures that might happen. And so it's not surprising that when the CDC conducts the NHANES, National Health and Nutrition Examination Survey study, a study that they conduct every other year on a sample of Americans from age 3 and up, they detect over 200 chemicals in the bodies of most Americans. And many of those exposures are actually higher in children as well as in people of color. And we don't have a good understanding of how these chronic, low dose but cumulative mixture exposures are impacting health. But suffice it to say that this is evidence that the chemicals that are in our environment and in the products that we're exposed to on a regular basis get into our bodies, and in children, in many cases, at higher levels than in adults. So zeroing in on some of the chemicals of concern that are present in artificial turf, and I've organized them here by what we know about their health impacts. A number of these are known human carcinogens, things like benzene, polycyclic aromatic hydrocarbons, styrene, some metals, PFAS chemicals, which I'll talk more about. Chemicals that are harmful to the nervous system, particularly the developing nervous system, like lead, endocrine disruptors like phthalates, microplastics, which could sort of go across all of these categories because they're really a mixture, and I'll touch on that a little bit. Chemicals that interfere with development of the reproductive system, chemicals that can be respiratory irritants. And we think that largely these chemicals may get into the body through 3 routes of exposure, and that would be inhalation, which may be less of a risk on an outdoor field, for example, but through dermal contact, absorption through the skin and open wounds, and ingestion, either intentional in the case of small children, or more likely accidental ingestion of some of the dust and particulates that get onto the hands and the body during play. So because of these concerns, so as I said, I just listed a small number of the chemicals that are found in artificial turf surfaces. Because of knowledge about those chemicals being present, the federal government launched a study in 2016 between the EPA, CDC, and Consumer Product Safety Commission to examine the safety of recycled tire crumb rubber. So myself and other speakers are going to talk about the other components of turf. This study was specifically designed to look just at recycled tire crumb on both playing fields and playgrounds. And the rationale for conducting this study, and I should say that at that time, the turf industry and many communities and organizations were making the claim that these products were safe. But EPA launched this study because, as they stated, studies to date have limitations and do not comprehensively evaluate the concerns about health risks from exposure to tire crumb rubber. And so what did they find? Well, they conducted a literature review. They characterized the tire crumb to see what chemicals were in them. And they did a very small exposure characterization study to try to get at what chemicals were getting into the body. And this was a much needed study. And it's still, I will say, a much needed study because this was a very small and limited analysis that they did. But at any rate, they confirmed there are over 350 chemicals in these products. There were very few studies that have been done to look at health impacts or exposure. We only have toxicity data for about half of all of those chemicals. I think that's really important to know, that we don't actually know the health impacts of exposure to many of them. And then when they did the exposure characterizations, they did not look at, for example, PFAS chemicals, which we'll talk more about, didn't think about heat or injury. And as they stated, it was not a risk assessment. And so within this report, the EPA concluded it is important to note that the study activities completed as part of this multi-agency research effort were not designed and are not sufficient by themselves to directly answer questions about potential health risks. This was a big study that we waited a very long time for the data to come out, and it really doesn't conclusively tell us about safety. And I mention this here because you will hear from turf industry and from other proponents of turf that this study concluded safety, and it did not, by EPA's own admission. So many communities have moved away from using recycled tire crumb rubber for the reasons that I just discussed, and looking for other alternative infills. And this is a study, actually, Rachel Massey is here, so she could speak to it more. But just to quickly show you that when researchers look at other types of infills, even organic infills, they identify chemicals of concern. But more than that, we're really concerned about chemicals that are present in other components of the turf field, namely the plastic grass blades. And this is Kyla Bennett with Tracy Stewart. And Kyla was one of the first, along with Jeff Gerhardt from the Ecology Center in Michigan, to identify the presence of PFAS chemicals in the plastic blades of artificial turf. And this is something that really sort of sounded an alarm, because if you are familiar with PFAS chemicals, you may know that they are per and polyfluoroalkyl substances. This is the family of chemicals that includes the Teflon chemical, which has now been banned for its carcinogenic properties, also Scotchgard. These are forever chemicals. They don't break down in the environment. They're used in food packaging, water-resistant clothing, so they have grease and stain and water-resistant properties. There are over 15,000 of them out. It's estimated in the chemical universe, widespread drinking water contaminants, and we can only really test for about 20 of them in the human body. So we don't really have a handle on what our human exposures are, but we know that PFAS chemicals are linked to impacts on many of the organ systems in the body, many health outcomes. Some of this came out of the C8 cancer panel, which looked at exposure to the Teflon chemical in the Ohio River Valley, and found carcinogenic effects, particularly increased risk of kidney and testicular cancer. More recently, these chemicals have been associated with increased COVID-19 severity and a decreased response to vaccines in children, as well as a whole host of other health impacts. And so I don't know if other speakers will speak to this, but many manufacturers now are claiming that their turf is free of PFAS. And just to note that each time this claim has been made, communities have found through third-party testing that this actually was not the case, and that PFAS chemicals could be detected in their turf field. So think it's really important to note, and these are state regulations in New York, but I believe California has similar, and maybe others can speak to this. But PFAS chemicals, because of all of the things that I just mentioned, are being phased out of numerous products, consumer products. The FDA has put a ban in place on PFAS chemicals in food packaging. In New York State, and I believe California has something similar. We have a prohibition on the use of PFAS in apparel as well as in carpet, and that is going to include artificial turf as carpet. So we're hopeful that that's going to lead to a reduction in the installation of these fields in New York. At the federal level, the EPA has been looking at the impacts of PFAS on health for quite some time, and PFAS in the environment. And so in their most recent progress report from their strategic roadmap, they said PFAS, the common term used for per and polyfluoroalkyl substances, are an urgent threat to public health and the environment. Communities across the nation are discovering them in their air, land, and water. The science is clear. Exposure to certain PFAS poses significant risks to human health, including cancer, even at very low levels. And it's important to note that sometimes the presence of PFAS in products like turf is dismissed, or even other chemicals in turf is dismissed as being at very low levels. But we're now seeing data from EPA and others showing that there is really no safe level of exposure to some of these PFAS chemicals. And so for this reason, EPA recently put in place new drinking water maximum contaminant levels for PFAS that are enforceable, that dramatically reduced the acceptable level of PFAS, some PFAS chemicals, 6 of the 15,000 that are out there, in our drinking water. And so something that we caution communities against is putting PFAS or putting turf down, knowing that it contains PFAS, and adding more PFAS to the environment and potentially to drinking water when these enforceable levels were just passed this year. So I thought, also important to share with this audience in particular is that, again, because of all of this new knowledge around PFAS, the National Academies of Science, Engineering, and Medicine put out guidance for clinicians on PFAS exposure for testing and clinical follow-up, and these were adopted by the CDC as well. And so when PFAS exposure is suspected, there are now blood levels of PFAS that indicate whether further monitoring or screening for thyroid disruption or certain types of cancers is warranted. Again, and you can find this online. This is guidance now from the CDC. They have some really useful information. Okay, so, okay. I thought I had another slide in there, but I think I might have deleted my microplastic slide, but we can talk about that too. So I wanted to shift gears really quickly, and I don't want to go past my time, to touch a little bit about heat effects of play on artificial turf. And so this is an infrared image of New York City, an artificial turf field side by side with a black asphalt roof. And you can see here that the turf field is as hot as a black asphalt roof. And so surface temperatures on these fields have been measured up to 200 degrees, regardless of the infill or the turf type. They are always hotter than natural grass, not only at the surface, but also at head height. And unfortunately, watering provides very limited cooling. So there have been studies done at Penn State on this, where you really only get maybe a couple of minutes of cooling when you irrigate. And in states where drought is an issue, we certainly caution against putting these fields in and thinking that you can water them, because you'll be using a lot of water to do so. And so this is just a little bit of data from my colleague at Mount Sinai, Homer Harari, who did surface temperature measurements on an artificial turf field and a playground in New York City. And he's done a number of these. And you can see the ambient temperature on this day barely reached 90 degrees. Similarly, here on a poured-in-place playground, you can see where the adjacent grass stayed around very similar temperature to the ambient air, but the dotted blue line shows the temperature of the rubber surface across the course of the day. And you can see that these temperatures reached upwards of 150 degrees Fahrenheit, even when the outdoor temperature was 80, 85 degrees. And again, natural grass stayed quite cool in comparison. And you can see a wood mulch playground also stayed cooler than the poured in place rubber playground. And the turf was also hotter than asphalt there. And so heat illness is the #1 cause of death and disability in high school athletes. This impacts football players, but also marching bands who are out there in wool uniforms in the hot summer. Those temperatures that I showed you on the previous slide are hot enough to cause second-degree burns. And so we see blistering and skin burns that can occur on these surfaces. And some communities, a limited number of communities, are now actually restricting play on these fields under certain circumstances, which is something that we would endorse. So if the surface temperature is above 100 degrees, so they have policies in place that the coaches should measure the surface temperature, and if it's above 100 degrees, they should not play. They also should not play when the air temperature is above 85 degrees and greater than 60% humidity, and exercise precautions or certain restrictions, for example, around wearing helmets or certain type of equipment that will heat them, taking more frequent breaks, limiting practices to the very early and late parts of the day. This is an example here. I can link this later. This is from Burlington, Massachusetts, which is one of the communities that has tried to clearly delineate a heat policy for play on turf. And I should say the alternative, what they are asked to do is play on grass. So it's not that it's too hot to play, it's that it's too hot to play on artificial turf. And so I think others this evening will talk about playability, which is a really important concern for many communities. And so while there are concerns around losing playable time because of wet weather, for example, there's also a real concern about losing playable time on artificial turf when the temperature is even sort of moderately warm. Injuries and abrasions are another issue. The data is mixed. Some of the studies have been a little bit mixed, but the preponderance of evidence now is suggesting that there are more actually knee, ankle, and hip and foot injuries with play on artificial turf compared to grass. This has particularly been emphasized by the National Football League's Players Association, who have been advocating sort of tirelessly to play on natural grass only. So half of the NFL plays on natural grass and half of the NFL plays on artificial turf. And some of these teams are starting to convert to grass because of these really major injuries that they're experiencing and because of how hard the play on these fields is on their bodies. Turf burn is not a heat burn, but rather skin abrasions. And you can see here, this is Sydney LaRue from the U.S. women's soccer team. Many years ago, the U.S. women advocated and then ultimately sued to be allowed to play on grass like the men were permitted to, and they now play on grass. But when they were playing on turf, they hated it for these reasons. And you can see how the crumb really kind of sticks to the wounds. This may increase risk of chemical exposures and can increase risk of infection with play on turf. Lastly, concussions. It's really important in particular to maintain these fields well. I think we can have more conversation about field maintenance, but these fields need to be well maintained and they need their hardness checked at least once or twice a year. Often this is not done, and this can lead to overly hard fields, particularly when weather is cold, and an increased risk of concussion from impact with the surface. And I think I did delete my microplastic slide, so I will just say, and I think maybe others can speak to this, that there are studies now showing that that turf is a huge source of microplastics and nanoplastics, with as many as 20,000 fibers, both from the grass and from the infill that enter waterways. Microplastics have been linked to numerous health effects, have been found in lungs, have been found in air, have been found in placenta, are a mixture of chemicals, and we're really trying to get a handle on what that means. But suffice it to say, turf is a source of microplastics. And lastly, we're very concerned about indirect health effects of climate change. Indirect effects of turf on climate change. They're petroleum-based. They release greenhouse gases throughout their entire life cycle. They increase risk of flooding. They're not pervious, and they create heat islands in communities. And we know, of course, that there are many additional health impacts due to climate change. We provide a number of tips for safer play. I don't want to go too far over time, but we highly recommend safety warnings, again, avoiding use on hot days, not using them for passive activities. Some communities, unfortunately, this may be their only area to play, and so it's where families go and have picnics. It's where kids have recess, and so, that's not ideal. Again, don't picnic, don't eat, washing hands, cleaning cuts, removing and shaking out gear. Like I showed you, my daughter's shoe was full of turf, showering, and particularly ventilating if you're using indoor fields. And so others are going to talk more about this. There are alternatives, and this is a field near my home where my kids were playing a few years ago. We have an alternative, which is properly maintained, preferably organically maintained natural grass. And so with that, I'll just share a QR code that will take you to some of our additional materials. You can follow us on social media at Sinai Exposomics or NiceCheck, Region 2 PESU. You can access all of our information. I can put that in the chat as well. We also have an ongoing study at Mount Sinai that's trying to get a handle on exposure that occurs during play on artificial turf surfaces, that is with a number of community partners and grassroots advocates. And so you can use this QR code to link to the information that we have there at that site. And with that, I will close and pass it to the next speaker. And
All right. Thank you so much, Dr. Evans. That was a fabulous presentation, and you really clearly stated the issues around artificial turf and children's health. And just to note, one of the things you brought up was the tiny amounts of like PFAS that are in it. And we're going to, in our next seminar in 2 weeks, Pete Myers, who was basically coined the phrase endocrine disruptors and has worked diligently on them, will explain why these small amounts are important. So he's explained that very well. So thank you. That was fabulous, really fabulous. All right, our next, now I'm delighted to introduce Rika Gopinath. She's going to present the essentials of organically managed natural grass turf. Rita Gopinath is the Community Policy and Action Manager of Beyond Pesticides, focusing on the Parks for a Sustainable Future program, which provides technical training to help city, county, and schools shift their public parks and fields to organic management, aiming for a complete transition across local areas. The Parks program creates demonstration sites, proving that robust, healthy, organically managed natural grass turf can actually withstand heavy use, capture and retain more water, and perform better than conventional natural grass turf. Better than a conventional, natural grass turf, while eliminating synthetic pesticides, herbicides, and fertilizers that can harm human health, pets, water, and wildlife. Rika brings a wealth of experience and a long history of working at the community level in California with grassroots advocacy groups, driven by a deep commitment to science-based solutions that foster healthier environments and sustainable communities through organic land care. And Rika also has a background in business communications and development. She received her bachelor's degree in political science and government, as well as studying public policy at University of Florida. Thank you so much for speaking to us tonight, Rika.
Yeah, thank you so much for the opportunity. And I stand on the shoulders of many, many national experts, and I'm thrilled that we have Dr. Evans and Dr. Macy here with us tonight. And thank you to Santa Clara County Medical Association for not just sponsoring this or, creating this opportunity for the webinar, but for being such a informative and educational voice in our community about this important issue. In my role tonight, I am going to be speaking on behalf of Beyond Pesticides, and really so let me start sharing my slides. And really our focus nationally is on creating technical expertise for municipalities, universities, and school districts across the country to be able to do natural grass turf like you don't see it often in our area, and that is without synthetic pesticides and fertilizers. So I'll get into that a little bit more, but before I do, and I had this all queued up while Dr. Evans was speaking, so my apologies. Can you see my screen, although it's still not playing?
Yeah,
There we
seems
go.
to be not on slide mode yet, but we can see it.
All right, well, we'll give it a second to catch up with me. Beyond Pesticides is a national nonprofit based in Washington, D.C. And I'm going to allow it. I hope it doesn't mess up my, this doesn't look right. Okay, one second. But Beyond Pesticides is a national nonprofit that is based in Washington, D.C. and was critical to creating the organic food labeling standard. And that is part of what may sound familiar when I start to talk about the way natural grass is managed with Beyond Pesticides Parks for Sustainable Future program. And that is similar to what you often hear with regenerative ag, organic ag, sustainable ag. And we'll get into all of those definitions in just a second. And let's see if I can make this work. Okay, end session. And stop share. And let me try and restart this. Best laid plans. Okay. And I promise my children are not on the internet because that was a problem before. So, and if they are, they're in big trouble. So let's jump into this. The second slide that I'll be sharing in just a moment is actually what I think is key that Dr. Evans was beginning to allude to too, which or in a different seminar that I saw you speak in, but just about risk assessment and how you, especially for the physicians and clinicians on this call, how you help parents and others really try and balance risk and reward with in particular, the opportunity to be outside playing. And one of the things that Beyond Pesticides is really passionate about is that we recognize that a risk analysis approach, a risk assessment approach, is how unfortunately much of the regulation is happening about pesticides in particular, but it's not precautionary. And so one of the things that we really think is dramatically important, especially when talking to anyone involved in healthcare, is to prevent risk, is to, you know, not just weigh what risk may come from exposure to PFAS, these forever chemicals, which you know, certainly many have argued is undisputably in every artificial turf, even though the industry likes to say that there are some without. But also the alternative that I want to really focus on in my next 11 minutes, which is, there we go. Can you all see that?
It's going to be coming up, I think, almost.
Okay, all right, then I will keep going.
There it is. You've got it.
Okay, fantastic. I apologize.
No
okay.
worries.
So, okay. Come on. Let's try down here. Okay. I'm going to skip ahead for just a second and come back to just a few points to continue what Dr. Evans was talking about. But I just want to talk about that precautionary principle. I think what's really important, especially as these community debates about where our resources should go in public spaces and public parks and playing fields for youth, is to really not just loop all of natural grass into the same bucket. It's not all the same. The first thing we need to ask is how it's managed. And 9 times out of 10, especially if it's not performing, and you hear things like, it has to be closed for the winter, or it must be closed every time it rains, or there are bear patches, or there are gopher holes. All of those things, except for the gopher holes, but there is a way to manage that. But all of those things indicate a chemical intensive or undermanaged conventional program. And what do I mean by that? That means that, like most landscapers out there, unless you tell them otherwise, they're going to be using synthetic pesticides, which includes herbicides like weed killers, insecticides, and synthetic fertilizers. All of those are petrochemical based chemicals, and they have harms, not just risks, but they have defined harms. And the science is getting clearer and clearer on that. So what's the alternative? The good news is there is an alternative. We call it a systems approach. Many of you who have heard or learned about regenerative ag, and I know that the Medical Association did a fantastic paper on that quite a few years ago. It's about soil health, and it's about not putting in synthetic pesticides and fertilizers. And those two things, soil health, not using synthetic pesticides and fertilizers, is really the definition I want to focus on tonight, because the results when you do that are dramatically different than a conventionally managed system. So the words that you sometimes hear are sustainable management, regenerative, and we at Beyond Pesticides use the word organically managed because that, by definition, like in certified food, means you are not allowed to use synthetic pesticides and fertilizers. All of it comes down to the soil. And the other thing about natural grass, whether we're talking about chemically intensive or conventional or sustainable organic, is what you put in is what you get out. So I think a lot of times in community debates, and by the way, not just our own here in the South Bay, it's happening all over the country, people tend to equate what natural grass fields are capable of with what they see currently. And unfortunately, currently, there is usually a lack of resources. Cultural intensity, not that you have to remember this later, but really the results are the sum of what you put in terms of products. And again, in organic or sustainable systems, we don't use synthetic pesticides or fertilizers. And how much labor is invested and how much water is invested. Now, the good news is about organic or even any natural grass system, you can use reclaimed water, and that is happening frequently all over the Bay Area. You can also do really clever things like capturing rain or even stormwater runoff to be able to use for irrigation. I just want to note what you cannot do is use any of those non-potable water sources on artificial turf. Artificial turf cannot handle anything like that. So when artificial turf products and manufacturers are talking about water usage, note, they're talking about our drinking water, and that's really problematic, not only for the resource that it is, but also because when it comes in contact with artificial turf, it can become contaminated, and guess where it goes? Right off the field into our surface and then groundwater and eventually drinking water. So that's really important. Both of these examples basically are natural grass, and the key is it can be managed. The expectations can be high, low, or medium, but what you get into it is what you get out of it. So before I jump into the rest of what I wanted to focus on with what's natural grass sustainably and organically managed can do, I just want to jump back to it for a quick second to playability hours with artificial turf. I know that one of the reasons I was asked to join tonight is to speak to that, which I will with several examples of natural grass fields that are managed differently. But artificial turf, unfortunately, the information is often coming from the people who make it and the people who sell it. And I think all of us need to sort of be buyer beware and ask for real world use numbers. What is absolutely true that's demonstrable even around our own Bay Area, and I think no one will forget today was 103 degrees where I am in San Rafael, and it's October, but there are heat closures. And as Dr. Evans talked about, the heat closures are going to increase, not decrease over time. One of the things that's very important that I'm not going to go too deeply into, but there is a California law that was passed, 1653, and it just went into effect in July. So California Interscholastic Federation, it's a high school inter-district sports league. They just started a policy. And for all of the physicians and decision makers, lawmakers on the call, we're watching this later, please look at not just the policy, which requires temperature testing, but please look at procedures, because I think what's really important about any regulation is how it's implemented. And I think we can all agree that there have been unfortunate and really tragic instances of youth in our own area dying of heat illness after playing on fields. Especially artificial turf, which gets a lot hotter. So I think this is a really critical issue. Natural grass, especially when well managed, retains water and absolutely is not as hot as artificial turf. And I think from a safety thing, that is incredibly important. The other important thing I just want to flag for anyone concerned about this issue or trying to compare apples to apples with natural grass in any kind and artificial turf, high use means high maintenance. And Dr. Evans talked about the impact safety testing. That is crucial. And for any parent or healthcare provider out there listening, it is critical that schools and municipalities are regularly testing these fields, and not just in one place. They fail. And they fail before their warranties are up and before they're supposed to be end of use. So that is absolutely critical. And the last point on this is that pesticides are absolutely required for most artificial turf. If you read the warranty, there are weeds that can grow on top of artificial turf. And so like Irvine, for example, had an integrated pest management policy. And in 2020, there were no synthetic pesticides used on any of their natural grass fields. There was, however, synthetic pesticides used on their artificial turf. Same city, by the way, where reclaimed water for their natural grass, potable water for their artificial turf, which is most unfortunate. The other thing to flag, especially for physicians on this call, I don't know of an artificial turf that doesn't require disinfecting. And I also don't know that it's done the way it is prescribed in warranties. And disinfectants, of course, are also pesticides. But that is one of the reasons that I think many are concerned about injury on artificial turf and the demonstrated rise in infectious injuries when they're there. Staph infections are more frequent on artificial turf. Then the last thing too, just to get back to usage, read the warranty. The manufacturer will tell you that those artificial turf fields need to be rested. They need maintenance every 60 hours of play. And this is the thing I didn't know, even though I've been looking at this issue for a while. The play is defined differently. So this is for anyone out there who's in charge of artificial turf fields. Please make sure that you are not just grooming it and maintaining it, but for impact safety testing, it is critical that you understand what the artificial field requires if you're going to be using it at such a high level. So with that, let me get into the fun stuff, which is what you get out of it is what you put into it. And that is better when you're working with nature, not against it. And Dr. Russell, may I just get a time check? I have 2 minutes left.
Yeah, you're fine. You can go for a few minutes. We're good.
Okay, great. So again, I mentioned our definitions, sustainable versus, sorry, can you see these slides okay, or is it small?
No, we see the slides. They're fine.
Okay, great. The definition then, sustainable, regenerative, generally those are not defined. So they're usually meaning focused on health of the soil, which is great. We tend to use the word organically managed because it can be more carefully defined. The good thing is all of those words mean science. Start with soil testing because every field, natural grass field, is different. And you get better results when you get site specific. I'm not going to go too much into the science of it, but if you know anything about the human microbiome, the soil has one too. And so the key to getting phenomenal performance out of natural grass is, first of all, knowing with specificity your own field by doing soil testing, having an expert help you learn how to translate that into management activities. And really, it's about feeding the soil. When you do that, you start harnessing eco benefits. In other words, you don't need synthetic fertilizer. You can really take care of the soil, which will then grow more resilient grass. There are also really cool things happening with grass species that, some are ribosome, which are rhizome activity, which are growing kind of laterally and can start filling in. There's some that are more drought tolerant, some hybrid natural grass seeds that use less water. And the one thing that we also know that is true is after a transition to a fully organic system where the soil is actually cycling its own nutrients, it starts to not only perform better, but it costs less to maintain, it uses less water, and it holds up to more play. And that is the key. Sustainable and organic systems get better over time because you're working with nature. And this is just another moment to sort of ask people to think about how natural grass is managed. If you see bare patches, if it's compacted, in other words, these are the two soil samples here, compacted soil, there's no room for the roots to grow. If you're using synthetic fertilizer, you're growing grass blades, but you're not doing anything for the soil. If there's poor drainage, a lot of fields in our area, because our soil is so clay-based and is not aerated properly or amended properly with compost and other organic amendments, it can't hold on to the water, and so it floods. And that's why it has to be closed in winter or when it heavily rains. I'll show you some examples where that is not the case after you get the soil working for you, and that's what's here on the right. The last thing I just want to point out that I kind of glossed over is an organically managed natural grass system is growing grass by taking care of the soil. So you irrigate differently, you aerate differently and more often. And what starts to happen is the grass grows deeper and more resilient, and your best herbicide is actually grass seed. So lots of, not rocket science, but definitely some technical approaches that are not always known, and not a lot of people out there to teach it. So that's why Beyond Pesticides is out there. One last thing before I jump into two quick examples, and then I'll pass it over to Dr. Macy, and that is chemical intensive versus organically managed natural grass systems. This is actually from a field I'm going to show you in just a second, but over time, the amount of cost is lower, more than 25% lower to maintain an organically managed natural grass system, and it uses less water. Here is an example of one of our, this one is one of our Beyond Pesticides Parks for a Sustainable Future program. Rain closures are rare. When it does close, it's for hours, not days. And the important part too is it gets better over time. This is one where a woman in Jefferson County who's also on the board of the Sports Turf Association, and a wonderful speaker. This is actually two fields that are managed in Jefferson County, Colorado, where it's nothing but 6 high schools playing football on it. Incredibly intensive. She manages it almost 100% organically and has only replaced the sod once in 24 years. The cost, and don't quote me on this because this is a more general cost. She's actually gathering that data for us now, but it is much lower than artificial turf over time. And especially now I want to look at 2 specific organically managed natural grass systems. And Dr. Massey, I think this will look very familiar. This is one of the wonderful case studies that was done by Dr. Massey and others. And this one is also the home of Beyond Pesticides organic turf expert. The number of hours that an organically managed natural grass field can sustain is higher. So please, when people tell you it has to be closed, they're not accounting for how it can be managed differently. And again, these get better over time. So over 2,210 hours per year. This is mostly soccer and lacrosse. The next one here is actually a football field. And this is actually where this data came from about the cost savings after 5 years. And I'll just end with this, which is when natural grass systems are managed sustainably or organically, it's all about the soil food web. And the following statements are true. Water is retained in the soil, which is why it doesn't have to close as frequently or if at all in the rainy season. It is about the creation and maintenance of the soil structures. Diseases are naturally outcompeted by healthy soil and plants. The cycle of life is in there, and then the nutrients are cycled at the correct rate the plant needs without using anything synthetic. So with that, I will stop and just say that we are actively gathering more data to share with you, and there are excellent regional examples as well. And we look forward to continuing to be part of a resource in this conversation.
Excellent. Thank you so much, Rika. That was wonderful. And I really appreciate your talk because it really highlights that we do have a lot to learn about organic field management, not only on sports fields, but also the whole topic of organic regenerative agriculture is now really a hot topic. And it's recommended for all agriculture to switch to this method in order to capture carbon in the soil and to save water on fields. So there's a lot we can learn. So thank you so much. And now we're pleased to have Dr. Rachel Massey here tonight. She is going to be discussing safer athletic fields, reducing toxic chemical use. She brings a wealth of knowledge and experience to us tonight. Dr. Massey is a senior science and policy advisor for Collaborative for Health and the Environment, a nonprofit that's focused on how environmental risks can impact human health. She's also a senior research associate at the Lowell Center for Sustainable Production, University of Massachusetts Lowell. She served as senior associate director at the Toxic Use Reduction Institute at the University of Massachusetts Lowell, where projects included state, federal, and international chemical policy initiatives, analyzing toxic use reduction opportunities for businesses and communities, and working in partnership with small businesses and grassroots organizations addressing toxics at the community level. She authored numerous reports for European government agencies and the United Nations on chemicals and development, chemicals and consumer products, and other topics. And in 2002, she received the Ken Zarka Memorial Pollution Prevention Champion Award from the National Pollution Prevention Roundtable. Rachel received a Master of Science in Environmental Change and Management from Oxford University, a Master of Public Affairs from the School of Public and International Affairs at Princeton University, and a Doctor of Science in Work Environment from the University of Massachusetts Lowell. Thank you so much, Dr. Massey, for being with us.
Thank you so much for having me. And Dr. Evans and Ms. Gopinath, those were really wonderful presentations. Thank you so much. So I'm just going to speak really briefly and without slides, and I'll just go through a few points really briefly so that we can get onto the Q&A. I've done research on artificial turf and natural grass fields, originally at the Massachusetts Toxic Use Reduction Institute, and more recently at the Lowell Center for Sustainable Production, both at the University of Massachusetts Lowell. And this work was done as part of a broader mission to help businesses and communities identify chemical hazards, reduce toxic chemical use, and assess and adopt safer alternatives. Excuse me. We have a variety of information resources based on that research, and I think that Dr. Russell will share the link where you can find all that information. So I know we're going to head into the Q&A soon, and I was just thinking about a few questions that frequently come up when we're talking about artificial turf and natural grass. So I thought I would just cover a few of them. The first one is we often get questions about what types of infill are used on artificial turf and whether there are differences among them. A few years ago, we did a comparison among infill materials based on chemical contents. We looked at infill based on waste tire materials, which Dr. Evans has discussed, and that's what was covered in that large EPA study. And then we compared that with alternative rubber and plastic materials, as well as some of the plant and mineral-based materials that are on the market. In general, the tire crumb infill, or the waste tire infill, contains the largest number of chemicals and the highest concentration of many of those chemicals. But the alternative rubber and plastic products can also contain some chemicals of concern. And then in terms of the plant-based materials, for the most part, they don't pose the same chemical concerns, although it's always important to check whether they've been treated or contaminated with any chemicals. But there can also be other concerns, for example, related to respirable dusts and fibers. Overall, we were not able to identify any infill material that was entirely free of concerns, although there certainly were differences among the materials. We can talk more about that if people have specific questions. Another area that we frequently get questions about is the question of a possible cancer cluster among soccer players exposed to waste tire materials through artificial turf, and about whether there's been any research to explore that possible association. So the short answer on that is that questions have been raised about this topic for many years, but no properly designed epidemiological study has been conducted to actually explore that question of cancer risk. There was a report that came out from the Washington Department of Health responding to the questions that were raised by Coach Amy Griffin, as Dr. Evans mentioned. But essentially all that was done in that report was a preliminary exploration of whether or not to do a cancer cluster investigation. They decided not to go forward with that investigation, and they chose not to do any active identification of cases. And there were some problematic assumptions and some misleading calculations in that report. So that project really did not answer any of those really important open questions. What we do know is that waste tire materials contain a large number of chemicals, many of which are known or suspected carcinogens or have other adverse health effects. So then the question really is just how much young people are exposed to. And then just moving on, and again, we can talk more about those cancer cluster questions if you'd like to. But moving on to one last area that we get a lot of questions about, and that's the question of PFAS in artificial turf. And again, Dr. Evans has already shared some information about this, so just a few more comments. In many cases, communities or the consultants working with them are ordering laboratory tests to find out whether PFAS chemicals are present in an artificial turf product that they might be purchasing. We've recently created some resources to help explain these lab testing issues in more detail. So just a couple of points that I think are particularly important. The first is to bear in mind that, as probably you all know well, that PFAS are a large family of chemicals, including thousands of individual compounds. And unfortunately, PFAS are now very widespread as contaminants in our environment and in our bodies. And this contamination is a direct result of the fact that they've been used in a wide variety of products and processes. So we now have the task of cleaning up that existing contamination, which unfortunately is very difficult and costly. And at the same time, we need to find ways to turn off the tap. That is, to prevent the introduction of any additional PFAS into our environment. So if you are hearing discussions about whether PFAS are present in artificial turf or whether the amounts that are present are significant, I think it's important to think about that in that context of that larger need to turn off the tap, to stop putting more PFAS into our environment. And then some specific issues that come up frequently for communities that are doing PFAS testing. One is detection limits. In some cases, tests are being conducted with a detection limit in the parts per million range, when the information that a community needs is in the parts per billion or parts per trillion range. So it's orders of magnitude off from the questions that the communities are trying to answer. Another issue is targeted testing versus other types of PFAS testing. Targeted testing looks for the presence and the concentration of specific individual PFAS compounds. So you can do targeted testing to look for just 2 PFAS compounds, or sometimes communities will look for 6 of them. Sometimes they'll run tests that would look for several dozen. But in all of those cases, it's about looking for a predefined set of chemicals. So what's important when you're interpreting those test results is that if a targeted test doesn't show the presence of the chemicals you looked for, that doesn't necessarily mean that the product is free of PFAS. It only means you didn't find the specific ones you looked for. So I'll stop there on that topic, but again, happy to discuss it further. So before I wrap up, I'll also just briefly share some information about the Collaborative for Health and Environment, or CHE. For those of you who are not already familiar with CHE, we bring together scientists, policymakers, and others to share the latest environmental health science with a goal of supporting policies that protect human health and the environment. So we invite you to join any of our programs. We sponsor several webinars each month, and we actually had one recently about plastic pollution from artificial turf. We also hold occasional in-person convenings, and we have an ongoing project on protecting researchers and scientific integrity. So with that, I will stop, and I look forward to the discussion. Thanks so much.
All right, thank you so much. That was wonderful, Rachel. And you don't use slides, you're an encyclopedia. You've done so much of this, and we put a lot of the information in the chat, the articles that you've written, and you've just done a lot of work. So thank you so much. I really appreciate you being here. And I want to thank all the speakers tonight for their excellent presentations. We're going to go on to the Q&A now. And if you want to put your questions in the Q&A box and not in the chat box, we're going to be putting some links in there. So here's a general question. What regulation exists to test these chemicals in artificial turf, and are they rigorous enough or accurate? So we already talked about the PFAS, but are there other things that they test for? And is there any routine testing, any laws in terms of testing? For anyone, if they want to.
Okay, I'll start, and then Sarah and Rika, please jump in too. What I have seen is that often vendors may provide test results that focus on a set of metals. And then more recently, often there's some test data related to PFAS. But for the most part, I believe that the testing is worked out kind of on a case-by-case basis. If a municipality or an institution wishes to request test data before making a large purchase, then they'll do that. But I don't think there's much in the way of standardized testing required by regulations.
Okay, and we have some new questions in the chat here. We have a lot of questions here. One is the California Academy of Family Physicians published a position paper against artificial turf bans due to concerns about childhood obesity, loneliness, and low-income children having less access to playing fields. Can you address those concerns?
Yeah, I'd be happy to jump in first. Dr. Evans, do you want to start actually?
You can go ahead. I'll follow you. Go ahead.
Just, this is something I'm really passionate about because I think we should all be concerned about childhood obesity and especially, low income kids and communities. And what I have learned working at Beyond Pesticides and looking at all the science is how impactful the body burden of pollution and pesticides in particular and chemical exposures are for low-income families, communities, fence line communities, farm workers, children's. There's a lot of issues there. And knowing that artificial turf and its ingredients have risk, it is unconscionable to me that we aren't putting more into the solution that makes sense, which is sustainably or organically managed natural grass, where we're doing good for the climate, for the people, for the kids, and for for the environment as well. So I think to me, it's not about the ban, it's about what do we do instead.
Thank you.
Yeah, and I agree with that. And I would say that, the state of the art field that we should all be striving to achieve is an organically maintained, beautiful natural grass field. We see that that's possible in Colorado. And if they can do that in Colorado and they can do that for the NFL, then we should be doing that for low-income communities of color as well. I totally agree. I work with a team of pediatricians. I also have children myself. And I, completely agree that outdoor physical play is critical for children's health and well-being. We get similar questions. I mean, we get questions like this. Should I let my child play at all? This is the only opportunity. Should I let my child play? Yes, you should let your child play and take the precautions that we've recommended. We get questions too, particularly in New York City. The only field that we have access to or playground we have access to is next to a highway. Should I let them play? And again, yeah, you need to let them outside to play. However, I think that it is an injustice to provide an artificial turf field composed of potential carcinogens, endocrine disrupting chemicals that may be actually themselves linked to obesity, and so on. That is the offering that you give to a community, under the guise that this is a state-of-the-art field. It's not a state-of-the-art field, and we need to shift away from that mentality that, this is the best that we can give our children. Sorry, Rika, you wanted to jump in.
No, I completely agree, Dr. Evans. And I just wanted to amend what I said, because I think, for all of those reasons, state of the art, there's an industry who makes lots of money selling these things. And I think that is the reason a ban on artificial turf should be supported, because it's in the public interest. It's very hard to compete against advertising information, to argue about the facts and the science. That's why the work of the two scientists and experts we have on the call tonight is so critical, as well as the work that our national nonprofit does. But that's what we're fighting against. So I think, just wanted to make clear that the ban is important for that reason.
Great, that's really well said.
I'll just add a little more. We often get queries and requests from people who are in environmental justice communities and who are concerned about losing the remaining green space that's available to them because it's potentially going to be replaced by artificial turf. So at least in Massachusetts, the aggressive marketing of artificial turf has been clearly identified as an environmental justice concern. And also, when you're thinking about opportunities for outdoor activity, it's not just organized space. It's not just organized sports. It's also informal play. And often when an artificial turf field is installed, people actually lose those opportunities for outdoor activity in actual green space.
Okay, great. Thank you. We have more questions coming in here. I'm just going to get back to one of these. One of the things that one of our first questions here was also, do we actually need grass? Local park of mine does have weeds and clover, but when mowed seems fine to play on. It's not really a sport field, but if anybody wants to answer that.
Yeah, I can jump in. That's a great question. I think it goes back to expectations. And if it's not a high performing, NFL or high school or a youth sport field, clover is actually fantastic as a playing field. I put a link to something that a colleague of mine wrote years ago about the case for clover. It fixes nitrogen. It's, great for the soil. It helps pollinators. It helps with water quality, and it looks great. And it grows well on fields. So I think for low managed fields without pesticides and synthetic fertilizers, clover is a natural.
Great.
And I'm glad you're enjoying it.
And I know in San Francisco, they say we're not growing grass, we're growing meadows. So when they had their integrated pest management, that's what they did too. And you go up there and play in the fields. Great. Are there concerns about cross-contamination of family members after children have played on artificial turf and returned home?
I mean, I can answer that sort of anecdotally in a couple of ways. One is just that my children are young, and so they just have had limited experience on turf. But when they have been on it, I've been really quite shocked at how much comes home, like what that we call take-home exposure is. So yeah, it's certainly possible. With any with any kind of outdoor play, the likelihood of tracking chemicals and other things into your home exists. And so we, as a general rule, recommend leaving your shoes at the door, right? And so when it comes to all of this equipment, we recommend, to the largest degree possible, don't even wear it into your car or shake it off and brush it off before you get into your car, but also don't track it into your home. And so taking off the cleats and the socks and the shin guards and all that stuff outside. So we don't have any data necessarily to say, there's an exposure to the child. But we know, for example, I could speak to pesticides, that pesticide residues are tracked into the home on shoes and other things that come into contact with the surface. So, it follows that there's a good chance that, yes, you're bringing those exposures into your home, and then they can get onto your furnishings and, to your pets and other family members.
Well, and of course, also then when you put the clothes in the washing machine, you're going to have effluent from the washing machine. They did a lot of studies on flame retardants that come off of clothing and so forth. So that just goes right back in. It has to be, taken out by, water purification. So thank you. Another question, is there information on aerosolized chemical exposure after playing on artificial turf as an additional potential area of concern? So,
I'm not sure if I'm understanding the question correctly, but I guess I can just say that a variety of studies have measured chemicals in the air above artificial turf fields. And some studies have also just measured the amount of rubber dust in the air. This is a particular concern for indoor artificial turf fields where there's less ventilation.
Oh.
Sarah, maybe you've got
Yeah, and I can add to that a little bit, just in part to the difficulty of doing those studies, and also to say that most of the studies that have tried to look at exposure have looked at air sampling, which may not actually be the primary route of exposure, but the best way to do that would be through personal air monitors, so that you really capture like what is at the head face height of the athlete. EPA in their recent exposure study tried to do that, but found that the personal air monitors didn't work very well in that capacity when the players were kind of rough and tumble, that they were getting disturbed or broken. So we don't have good data on that, unfortunately. But you can imagine at a certain level of play that there is dust and particulate that is kicked up. And that's a particular concern, for example, if you've watched how goalies interact with turf in soccer. So, for VOCs and things like that in the outdoor environment, they may dissipate pretty quickly. And like Rachel said, indoor is where you might get more of those exposures. But for that personal exposure to dust, microplastics, small particles that are kicking up, we don't have good data to confirm, what those exposures are. I don't know if that's
great.
helpful.
Okay, thank you. And I want to just point out, I did put in the chat a bunch of references, and we also do have policy recommendation that the Santa Clara County Medical Association did on artificial turf, preferring natural grass fields to artificial turf. And the CMA has actually come out with a similar recommendation, preferring natural grass fields. And in our policy statement, it does have a lot of resources. So you can click on that. And it has a lot of resources, a lot of different things, all the different aspects. So here's another question that does come up. Do organic grass fields require a lot of staff time? We hear that we don't have resources in my city. That comes up a lot. Anybody want to tackle that? Rika?
I was just in the middle of writing a long answer back to that. But, you know, I would say the good and bad news is that often comes from what city or public works staff don't know that they don't know. There are a lot of assumptions when you unpack what they think it requires. And I would say, you know, that's basically what I do for my day job. I manage Parks for Sustainable Future program, and we go in and work with cities and pick like 2 or 3 natural grass fields. And we always start with soil testing that the city pays for, and the expectations and the current budget, including labor. And the magic is that our national expert can create a 2-year transition program that uses the existing budget and just reallocates it. And it's totally possible. And we provide training, and the training always surprises staff. I sit in on those trainings often, and we've done some of them regionally in the past few years as standalones. And it's not rocket science, but it's a problem-solving mentality. So if you picture, you know, what many of you who own lawns or yards or homes, you know, people come in and they mow this and they spray this and then they're done. Well, that's a conventional approach. A systems approach, sustainable, organic, or however you want to define it, is starting with the soil and doing what it needs. And the inputs are not dramatic. The labor is about the same. And especially when you start comparing it to artificial turf, you got to take care of that too. It needs to be groomed. It needs to, the infill needs to be fluffed. Otherwise you get, you know, concussions when people are playing on it. So the labor, you know, it's all in how you do it. And I think that's why many people don't, you know, worry about the word organic. Organic, you know, seems like it's more expensive because, I don't know, organic food is sometimes more expensive, and sometimes that's not true either. So yeah, it does not have to be more expensive. And over time, the thing that is always true in a well-managed, you know, sustainable organic system, it gets better and cheaper and easier as nature works with us instead of against us. Thank you for that question.
And that's good. And I think if you look at some of the studies that were done in the Santa Clara County Medical Association policy, there are several studies that show that it is actually far cheaper to have a grass field than an artificial turf, because indeed every few years you have to actually bring in more infill because it has to be replaced as well.
I'll just add one more thought, which is a community that doesn't have the capacity to do intensive improvements on their natural grass field can make small improvements and they'll still make a difference. So we have worked with municipalities that had just a very tiny budget for making some improvements to their practices. And so they just added aeration to their maintenance schedule. And just doing that made a difference. So there's a continuum when you're thinking about management of natural grass fields. And I guess at one end of the continuum, you've got just adding a couple of best practices, whether it's aeration or soil testing or both. And then at the other end of the spectrum, if you're in a community that's looking at a large investment in infrastructure, then you can look at, rather than only looking at the possibility of making that large investment in a rubber and plastic product, you can look at spending those same funds on a really well-designed natural grass field. And if it's well-designed, from the start, then you're going to have an even easier time with the maintenance.
And if I can just add to that, because Dr. Macy brings up something really important that I did not get a chance to address, and that is performance of natural grass fields, especially like, in the now. That is essential, because oftentimes just like regrading it so that it drains better, there's some really simple things, aerating it more so that the soil can hold more water, adding some amendments. It is definitely a continuum. And I think the other thing about cost is the life cycle of an artificial, expanding the time frame of how we're looking at costs, so that we are
right. And then I think another note was that you have to replace it about every 8 years to 10 years. Usually 8 years, it's completely gone. So that's another huge cost, and not only to replace it, but also disposal. And that's a huge and separate issue we probably don't have time to talk about now, but very difficult to dispose of the artificial turf. It often gets dumped on fields. I want to ask a couple questions more. We just have a few more minutes. One thing is for Dr. Evans, what do you tell physicians when what do you tell physicians? How do they talk about artificial turf to their patients when they ask? What do you tell them about it?
Yeah, so first I'll say that
this
is not an area that most clinicians have and pediatricians have expertise or training in. The amount of environmental health education that medical students get is very limited. And so part of what our team strives to do is to educate clinicians in how to respond to these types of questions. I think that, again, we do emphasize the importance of outdoor play and recognize that many individuals don't have a choice in terms of where they play. So a lot of the questions that come to us are from families who the only playground or the only field at their small child's school, for example, is artificial turf. And the question might be, should I not let them play? And so that's a hard conversation, I think, to have with the family. And so generally what we advise and what we advise clinicians do is to try to get best practices in place in the school so that the kids are not, eating or lounging on the surface, that they're washing their hands when they go back to the classroom and that kind of thing. So giving those kind of recommendations that I shared in that checklist around protecting yourself if you have to play. And then, what we've done at Mount Sinai through our materials is to create kind of lay-friendly information that a patient could take away with them. We have a program called Prescriptions for Prevention, for example, that's literally like a small prescription or fact sheet that a pediatrician could hand to their patient who has a question about environmental exposures, that has additional resources so that they could go to their school or their coach or their town and say, these are evidence-based recommendations from my doctor, from this academic medical institution with these recommendations. So I think we try to strike the balance in not stressing parents, particularly in pediatrics, dealing with families, not causing undue stress, but also empowering them with something that you can do about this at the individual level, and then hopefully like at the advocacy level within your community.
And I thank you for that, and it's fabulous. I'm going to go look for those. We have a couple more questions, and I want to just point out I did put the policy for Mount Sinai on artificial turf up there too. A link to that to prefer natural grass fields. And what do you think? Do you think that there should be? We have 3 minutes. If we can answer these quickly. I've noticed many new parks, such as the ones being made of these parks, are made for those with special needs, but looking at them, they seem to use artificial turf, but also the spongy blue surfaces. Are those also in the same category as artificial turf? If you want to answer that quickly. Dr. Evans, I don't know.
Yes, so that is similar to the playground slide that I showed, where usually there's recycled tire rubber beneath another, layer of plastic or coated rubber. So there are similar exposures. That's the kind of surface that also gets really hot. I showed temperature data exactly from a surface like that. So yes, those are thought to be more accessible, more, easier to maintain, cushion falls, et cetera, et cetera. But they break down, they release particles, they contain the same kinds of chemicals of concern. So there is something called engineered wood fiber that is we think to be a safer alternative that doesn't use rubber, that's wood, that's also ADA compliant, that is an alternative for, when you need that kind of a surface.
Great, that's awesome. And another one, I work for an environmental organization, Clean Water Action. We have one other environmental group promoting artificial turf in low-income communities. And I mean, you probably already answered that, but again, do you want to repeat any other points about that?
Yeah,
She
the
says
one
it's frustrating.
I feel also very strongly, in environmental health, we're very concerned about environmental justice communities and those that are disproportionately impacted by pollution sources. The one thing, I think we all touched on that, and one thing that we didn't mention is the urban heat island effect. So I just wanted to come back to that idea that we're really heating up these communities that are already, potentially disproportionately hotter by putting in an artificial turf surface, which, as I said, is just like putting in an asphalt parking lot, essentially. So I think maybe that's the only thing that I would add, but really want to caution communities. Sometimes the only green space or the only cooling space that is available in low-income communities is a grass park, and you lose that if you replace it with turf.
So thank you so much. I want to just ask one more question and then we'll end. Let's see, I'm back. What policies, do you know what local or state policies you'd recommend around artificial turf for schools, for states? Heat guidelines, having a temperature monitor, are there any, out there very quickly? You have an answer?
I think that in looking at the new California, regulation going into effect, I think one of the things that was clear, especially as I found out that several school districts are applying to change their categories so that they can not, use it more under certain, under the guidelines that are driven by temperature. I think the important thing for anybody involved in decision making around artificial turf is to not just comply, but think proactively of how to protect our youth and health and anyone using those fields. And that comes in procedures, not just checking a box. And to your point, measuring ambient temperatures, measuring it the way it's supposed to with equipment, et cetera. And then building options that are not plastic.
Excellent. So I just want to say thank you, everybody, for participating tonight, all the effort you put into this. You did a wonderful job explaining this, answered so many questions, and we really appreciate your participation in this webinar. I want to thank everybody who participated and asked questions. I want to note that 2 of our speakers here live on the East Coast. It's much later there. We appreciate your being here so late. Get a good night's rest when this ends. And I want to also thank our SCCMA staff for their tireless efforts, including especially Emily Corin. So join us for the next forum in 2 weeks, Environmental Toxins, Environmental Illness. These presentations are recorded. They're going to be available on our website, sccma.org, after the webinar. So stay safe and have a nice evening, everyone. Good night. Thank you so much.